Hello students, in today's lecture we will discuss the external ear. Now if we see the ear as a whole, what are the functions of ear basically? It is the organ of hearing. It maintains equilibrium of body. Now this ear consists of three parts, that is external ear, middle ear and internal ear. So this is introduction regarding the ear, and these are the parts of ear basically. So if we see external ear, middle ear and internal ear, external ear it includes the pinna or auricle, external auditory canal or meatus. Middle ear has tympanic membrane, ear ossicles, middle ear cavity and eustachian tube. Then internal ear has these structures, that is oval window, round window, cochlea and semicircular canal. Now coming to this auricle portion, we will discuss the external ear in today's lecture. Now auricle is basically a single crumpled piece of cartilage and connective tissue covered by skin. So it has various parts. In the diagram you can see this is the helix portion and this is the antihelix portion. So this is the antihelix. In between this portion is the scaphoid fossa. So this is the scaphoid fossa. Then comes the concha that you can see here. So this portion is called as, this bigger one is known as Symba conchae. This is tragus, this is antitragus and this portion is the lobule. Now this Symba conchae is leading to what, that is the acoustic meatus. And that between this tragus elevation and antitragus, this cleft is known as intertragic notch. So these are the parts of the auricle. Now coming to the nerve supply of this auricle, if we see the root of the auricle with which it is attached to the side of the face, so this root is supplied by the auricular branch of the vagus nerve. Now if we see this free portion of the auricle, we divide it into upper 2/3 and lower 1/3. Now upper 2/3, if we see, this is the upper 2/3. If we see the medial side of this, it is supplied by the lesser occipital nerve, that is towards the skull, that portion of the auricle which is facing towards or touching the skull, side of the skull. And lateral portion is supplied by the auriculotemporal nerve. Now in lower 1/3, so both lateral and medial surfaces, they are supplied by one nerve, that is great auricular nerve. So these are the basically nerves which are going to supply the auricle, that is auricular branch of vagus nerve, lesser occipital nerve, auriculotemporal nerve and great auricular nerve. So their contribution is by dividing the auricle into upper 2/3 and lower 1/3. Now coming to the blood supply, it is supplied by the posterior auricular artery and superficial temporal artery. And lymphatic drainage of the auricle is by the pre-auricular group of lymph nodes, then post-auricular group of lymph nodes and superficial cervical lymph nodes. So these are the lymph nodes which are draining the auricle. Now coming to the next part of the external ear, that is external auditory canal or meatus. Now it extends from the bottom of the concha, as we have discussed, to the lateral surface of the tympanic membrane. So this whole portion is given the name external auditory meatus. So length is about 24 millimeter. Out of this, the medial 2/3 portion is bony and which is 16 millimeter, and lateral 1/3 is cartilaginous, which is 8 millimeter. Now the bony part is enclosed in the petrous, in the temporal bone basically. So this is the bony portion which is enclosed in the temporal bone. Now you can see here, so this is external auditory meatus extending from this portion and going to up to the tympanic membrane. So this is auricle and external auditory meatus, they form the external ear. Now in newborn, the meatus is short and straight. So this meatus is short and straight in case of newborn, so directed downward and backwards because canal is cartilaginous. Now the skin lining the meatus has thick subcutaneous tissue containing ceruminous glands. These glands, they secrete the earwax. So this is the area which is covered by the skin, and hairy skin is there which secrete the basically a ceruminous gland. Secretion is basically wax, and that earwax is lying in this meatus. Now if we see the direction or shape of the external auditory meatus in adults, it has three parts, that is outer part, middle part and inner part. The direction is, for the outer part, is directed medially forward and upwards. So it is directed medially forwards and upwards. Middle part is directed medially backward and upwards, and inner part is directed medially forward and downwards. So it is just a S-shaped structure. Now, if we do the clinical examination, because if we want to visualize the tympanic membrane, we have to make the canal straight. For this, the auricle is pulled upward, backwards, and slightly laterally. In this way, this S-shaped canal, it is becoming a straight canal. With this, the tympanic membrane is better visualized. Now, blood supply of this external artery meatus is outer part is supplied by the posterior auricular artery and superficial temporal artery, and inner part is supplied by the auricular branch of the maxillary artery. So, these branches are going to supply the inner portion, and outer is by the posterior auricular and superficial temporal artery. Now, lymphatic drainage is almost the same as of auricle, that is pre-auricular group of lymph nodes, post-auricular group of lymph nodes, and superficial cervical lymph node. Coming to the nerve supply. Now this nerve supply, that is anterior half of the skin, you can see here, it is supplied by the auriculotemporal nerve, and posterior half is supplied by the auricular branch of the vagus nerve. So this is how it is going to supply, it is getting the nerve supply. Now what is the clinical importance of this portion of ear, that is external ear? So during examination, hallux is pulled posterior-superiorly in adults and infero-posteriorly in case of infants. Then second applied importance is excess of wax may be deposited in external acoustic meatus, which may dry up and causes a sense of blocked ear. Wax is removed by syringing a canal with normal saline, which can cause stimulation of auricular branch of vagus nerve, which may result in reflex coughing and vomiting in case of children. Now, continuous irritation of the auricular branch of vagus nerve, it leads to the persistent cough. Then cough is there. So even death may occur. That is, sudden cardiac inhibition is there. So this is while doing the syringing of the external acoustic meatus, we should keep in mind the relation of the auricular branch of vagus nerve with that. In herpes zoster infection involving the geniculate ganglion of the facial nerve, vesicular eruptions appear in auricle and ear canal. This is because the auricular branch of the vagus nerve, which is sometimes connected with the facial nerve, so that may be involved. Now, in case of if a caries is there in lower teeth and carcinoma of tongue is there, then patient can feel a rapid pain in the ear canal, because nerve supplying the ear canal is auriculotemporal nerve, that we know, arising from the same division of the mandibular nerve from where the branches supplying the lower teeth and tongue they are arising. For lower teeth it is the inferior alveolar nerve, and for the tongue it is lingual nerve. So these branches are arising from the posterior division of the mandibular nerve. They have common origin, so that's why the rapid pain may occur in case of these pathologies. Thank you very much. So this was a very short lecture. So in next lecture we will discuss the tympanic membrane. If you like my channel, kindly subscribe it, share it. Thank you very much.